Hello and welcome back to my channel. We are having another weight loss update today, as you can tell by my thumbnail and the title of this video. This update is going to be about the operation itself and my hospital stay only, as I don't want these videos to be like 3 hours long. And I've got a bit of a plan of how I want to sort of lay them out to give you the most and more thorough information without overloading it too much, because it's a lot of information. Just bear in mind before we go into this, my journey will be different to most other people, unless they've had the surgery with the same surgeon. That then they're probably going to have as close to my experience as anyone can be. But again, they will still be different because everyone's unique, everyone works different, everyone's body reacts to surgery in a different way and to weight loss itself as well. So just bear that in mind if you are deciding to go through with this surgery. Just a reminder, I had the gastric sleeve on the 6th of April 2024. So I went into hospital at 7 a.m. on Saturday, the 6th of April. I've just said the date twice, whatever. Anyway, and nice and early on a Saturday because everyone loves that, especially when they work the day before, which I had. I worked up until the last day I possibly could just to make sure that there were no issues. Yeah, so I went in. It was very easy. I signed in, went to my room. I did have my own room, as it is private. I don't know how it works with any NHS, or if you are somewhere else in the world, how it works in the hospitals near you. However, for me, I did have my own room because I paid for it, basically. um, yeah, so I had my own room. It was lovely. It was just, I mean, it was very simple, but it was a decent size. I could walk around it quite easily. Um, I had my own bathroom as well, so it was all very private, which was nice. I do have a little video of it, which I will insert here for you. Um, yeah, yeah. So I have my own little room. As soon as I got in there, I think we were left for about 10 minutes, and then the nurse came in. He asked a couple of questions based on whether I had what medications I was taking, if I was on any medication that should be concerning for the anaesthetic, any sort of like things like loose teeth that could cause a problem with when you have the tube put in, and anything else that might be a concern. I mean, they're very standard questions, so if you've had surgery before, I'm sure you are aware of those questions. Because I'm sure it's very similar for every surgery. They have to have the same. They have to go through the same thing because it's still, I think anaesthetic is the same in all surgeries unless you're allergic to anaesthetic or you have problems with the anaesthetic. Um, so yeah, I think that was within the first 30 minutes. That was all done. I was then visited by my anaesthetist, who again went through probably a lot of the same questions, but he had some other ones, and he wanted to go through the process and how it works, considering I've never had surgery before, so that means I also have never had anaesthetic, so I didn't know how my body was going to react to it. So it was all going to be a learning curve for me and also for them as well. Well, not they've obviously had other people that have had the same thing, but like, you know what I mean. um, so yeah, so then he left, and the nurse came back in with my lovely stockings that I have to wear for a month. These are to stop blood clots, so they have to be worn. Um, so yeah, so they came in with that, and then another lady came in who was just doing the schedule for the surgeries, because there wasn't just me who was having surgery. There was a couple of other people, and they put me first to have surgery, which I'm very pleased about because, to be honest, when you haven't, I don't know if any of you have had the same feeling when going into surgery. If you've had surgery before, the wait would be awful. So I'm really pleased that like I was the first one in, and I think they came to collect me at around 8:45. So I only really had to wait an hour and 45 minutes, and a lot of that time I was either getting changed into my hospital gown, or I was speaking to different um, nurses, to the anaesthetist, lots of people coming in and out, just sort of checking everything. They also did my observations just to make sure that like my blood pressure and all of that was fine, and it was fairly simple after that. So at 8:45, I walked to the theatre room. I don't know if this is normal for other operations, but for me, I went straight into the operating theatre without having like going into the room before, because it is safer. Less time. I mean, it's very minuscule, but it's still less time, and also less moving of the body, which can cause pain afterwards, which I have experienced. Um, so I was put onto the table. Well, I got myself onto the table, and the anaesthetist started to put the cannula in my hand. They did have a couple of problems with getting the cannula in my hand. I do have very stubborn brains, that too. Um, Veins. Sorry, I have a bit of brain fog quite a lot. So if I say something stupid, it's because my brain hasn't caught up to my mouth. Um, and I think that's actually normal for quite a lot of people, but I've got like it extra at the moment. Um, yeah, so I was, they were working on that. Took them a bit of time. My hand still hurts from it. My vein is still very tender. Um, but it's fine. I think it's just very bruised. Considering it's 2 weeks on, still that for that to be still tender, that means that it was overly abused. But anyway, they did get it in the end, thankfully. And they gave me, I can't remember the name of the drug, uh, Zalapan or something like that. It started with an M, I believe, and which made me very lightheaded. It kind of made me feel sort of really, really drunk, and what I probably expect to feel like if I've taken drugs. I've not taken drugs in that sort of sense, so I don't really recognize that feeling. Um, so yeah, so that happened, and then I don't remember anything. It all completely gone from there. I do remember waking up very briefly in the recovery room, which I think is normal. They have to make sure that you do actually wake up, because that is a concern as well. So I do remember briefly sort of slightly opening my eyes, but being very blurry. And I could hear nurses' voices and things like that. So that was fine, and I think they then just let me sleep, and just I was in the recovery room from what my parents say for about an hour, which I think again is probably normal. I was then taken back to my room. Don't remember being taken back to my room. I just remember sort of half waking up, not opening my eyes, but I could start hearing things. Um, and paying attention to what was going on in the room. I remember my dad coming in and just being like, I'm going to go. I don't know whether he was coming in or whether he was already there. I don't remember that movement, but I remember him saying, I'm going to go and get a sandwich. um, and then after that, I heard sounds, but I didn't really hear voices. I physically couldn't move, and I couldn't talk. I couldn't really open my eyes. I reckon if I tried really hard, I could, but I didn't want to at that stage. So I ended up sort of just I guess dozing. This is the easiest. Dozing without being able to move is probably the easiest description of it. It was very strange, really. But I do remember having really, really bad chest pain, like the worst chest pain I think I've ever had. But that I kind of pre-surgery, I already kind of expected that, because I knew that you get like gas because of from the type of operation I had, because it was keyhole. They had to pump your stomach with CO2, so I expected that to be to sort of travel up and into my sort of chest. I expected to have it a lot in my shoulders, but I didn't, which I think I'm actually probably quite pleased about. I don't think it's very nice if you have that. But yeah, so I remember that. And I remember when I did, I mean, I could still hear people. Apparently, my surgeon came in quite a few times to check on me um, during that day. I remember the last one, but I don't remember the times when he was coming in to check on me when I was still sort of half asleep. Um, so from there, I don't have any sort of idea of timings and how long it took me to wake up. I don't have any of that on when I started to sort of really start moving and being able to get up. So after that, well, at some point after that, I did wake up, I did open my eyes. And I think one of the first things I said was that I needed to use the bathroom. So I ended up deciding that, okay, I'm going to get up, I'm going to use the bathroom, and then decided that that was a really good time for me to go for a walk, because with this surgery again, because of the gas, it's really good to just get moving as quickly as possible to help relieve the pain. So my brain was like, okay, if I walk, this will stop hurting. Obviously, it's not going to stop hurting straight away, but my brain at that stage wasn't thinking about the fact that it will stop working straight away. It was just thinking, oh, it might fix it. It didn't, but it probably did help. So I got up, I walked like I think a quarter of the hallway. The hallway was quite long. I probably walked like past maybe two other rooms, and then walked back, because that was enough for me. I tried to sit in the chair, but I was starting to feel dizzy and very lightheaded. I was trying really hard to push myself, probably when I shouldn't have pushed myself that hard. Um, but I did it because I needed to. And I knew the surgeon was keen to get me up and moving as soon as possible. So I went back to bed after that. I had family around me that whole time. I don't think they left until quite late in the evening, because I went private. You have longer visiting hours than in like normal hospitals. So if for the UK case, the NHS. For America, I don't know your policies, and again, the rest of the world, again, I don't know how it works for you and where you are. So that is something that you all need to ask in the place that you're going to see. So I was in hospital for 2 nights, 3 days, pretty much 3 full days, almost. Um, so Sunday was again very similar. Getting up, moving around, using the bathroom. My family came. I went for a walk with them. I was much more active on the Sunday. I didn't get any sleep really. I think I got about 2 hours sleep the Saturday night, which I also expected because I had to sit upright, and I don't sleep very well upright. I'm a girl who sleeps on like half her side and half her stomach. So sleeping upright was really weird for me. Um, I didn't like that. But I was going to do it because that's what I had to do. You do what you have to do, right? So yeah, so that's what happened on Sunday, and I think I had a lot of my family members come. My mum and her partner came, which was lovely, because that's what I was surprised, because I didn't expect my mum's partner to come, because he doesn't like hospitals, so I didn't expect him to come, but it was a really, really nice surprise that he did. And then my dad, my sister, and my younger brother came later in the day, which was also really nice. Again, another surprise that my brother came, but I'm very happy he did. They didn't stay very long, but neither of them stayed very long, but they stayed long enough. And then my dad came back after dropping off my brother and my sister back at the station. So, and they came from London, and I am just outside London, so it's about a 40-minute journey. I feel like my nose is really red. I feel like I'm a bit of a reindeer right now. Anyway, that's just probably me overthinking about it because I'm staring at my face while I record this video. Um, Anyway, yeah, so that's what happened Sunday. I had my first food on Sunday. I didn't eat anything on Saturday. Didn't want anything on Saturday. I had soup. I had tomato soup, and oh my god, it was the best thing ever after the LRD. Again, I'm gonna do a whole video on the food aspect of it. I might do a whole video on the LRD itself, and then the whole video on the post-op diet, because they're very different and I don't want to confuse them, so I might do them separately. They may be slightly shorter, who knows, probably not. So yeah, so that's what happened Sunday. Then Monday was my day. I slept a little bit better on Sunday night as well, not much but a little bit. Then on Monday I was still in hospital. I stayed in hospital about 4:30 because they're waiting for my medication, which took a bit of time. But I had to have extra antibiotics because one of the things in my blood was indicating that I was at risk of infection. So they caught that really, really early, which meant that I didn't have to. They caught that on Sunday morning. Actually, they caught that on Sunday morning, and then they put me on extra antibiotics throughout the day and into Monday, and then afterwards as well. So I took home antibiotics because I had that risk of infection, which was fine. The taste is gross, but it was fine. So that was the only thing that was that didn't go quite as to plan, but it's fine. We dealt with it. I'm hopefully fixed. I think I'm fixed. Otherwise, my surgeon would have said something already, but it hadn't been because I've already had a blood test since my operation. Since I left hospital actually. So yeah, and then Monday I left. I went home. I briefly came back to my flat, to pick up some stuff, and then I stayed with my mum for a week. But I will go through my post-op in another video. But that's basically everything that happened in the hospital. Again, please, just reminder to you that everyone's journey is different. My journey will be very different to what your journey will be. There will be some similarities if you're having the same surgery, but your surgeon may decide something different for you that I didn't have to do on my side. So please take everything I say with a grain of salt, but you can use my journey as as a sort of understanding of how potentially it could work. But again, it could be different for whatever surgeon you have. But anyway, I'm going to end this video before it gets too long. And I just want to thank you all for watching. I really do appreciate it. I appreciate the fact that I haven't had any backlash for this, because I was a little bit concerned about that, but feel very positive and happy, and I'm very happy at myself at the moment, so it's all a good stepping stone into the future, isn't it? Anyway, if you don't know already, I do stream on Twitch. I do normally stream gaming videos. If you've looked on my channel, you'll see that most of my content is gaming. This is just a little bit of a side hustle, I guess. Thing that I'm doing in my personal life, and I want to keep you guys updated so you know what's going on, and also to relieve those negative connotations that come with weight loss surgery. Anyway, if you want to follow me on Twitch to catch me live on stream, and if you want to ask me questions in those streams, I'm more than happy to answer them. I'm very open when it comes to things like this because I think it's really important. So you're more than welcome to join me over there. All of my links for Twitch and my TikTok, I don't really use my TikTok that often, are all in my description. And yeah, if you haven't already, please subscribe, comment, like, hit that bell notification so you always know when I upload, and I will see you in the next update. Bye!